who have heart disease come to me and tell that I do not take egg, especially I do not take the egg yolk because it's rich in cholesterol. And if I take more cholesterol in my food, I'll get more blockages. So eggs are basically have some people say there is a nutritional powerhouse, while at the same time some others say that it is a cholesterol bomb. So who is correct? Nutrition as a whole, eggs are very nutritious. They are rich source of protein. They have other important nutrients in them. They are rich in omega-3, they have vitamin D, they have antioxidants. But at the same time, eggs also have cholesterol. One medium-sized egg has around 180 milligram of cholesterol. So herein lies the fear. Most of us are fearful of the fact about egg yolk. They think egg yolk has high cholesterol, and if you take more cholesterol in the diet, we will develop a heart disease or heart attack. Is it so? We'll discuss about that in today's video. So the problem with egg or egg yolk is that egg yolk contains cholesterol. Yes, definitely the egg yolk contains cholesterol, and that too significant amount. But does eating cholesterol in the form of egg yolk increases your blood cholesterol? The answer is no, at least for most of us. So our body has an intricate mechanism. Our body requires cholesterol for various functions, and the blood cholesterol, the 80% of the blood cholesterol is provided by our body. Our body, especially our liver, synthesizes cholesterol. Up to 80% of our total cholesterol is synthesized by our liver, and only 10 to 20% is from the diet. So that is something which you should always remember. The bulk of the cholesterol which we have in our body, actually our liver only synthesizes that, and dietary contribution is only minimal. So much so that the body has an important balance. Whenever we take less cholesterol in the form of food, suppose we are not taking any cholesterol, we are not taking egg yolk, our body sees the cholesterol is less in our body, so liver synthesizes more cholesterol. At the same time, if you increase our cholesterol intake in the form of diet, in the form of egg yolk, our body sees that okay, we are getting more cholesterol from the food, so liver synthesizes less cholesterol. So body maintains a balance depending on what is your dietary cholesterol intake. Depending on whether it is more or less, body synthesizes more or less to maintain the balance of cholesterol. Why? Because cholesterol is an important substance in our body. Without cholesterol, there is no life. So contrary to the popular belief, we tend to think the cholesterol is poison. Cholesterol means heart attack. Cholesterol means heart disease. Cholesterol means stroke. Actually, it is not so simple, because cholesterol is required for every cell of the body. Cholesterol, all the cell membranes are formed by the cholesterol. Hormones, various hormones are formed from cholesterol. Vitamin D is synthesized from the cholesterol. Our brain is made of cholesterol. Our nerve function is made of cholesterol. In fact, cholesterol is important for our digestion and absorption also, because bile, which is produced by the liver, also is produced from cholesterol. So cholesterol is important for our life. Without cholesterol, there would be no life. So the problem is not cholesterol. The problem is when the cholesterol gets damaged. So when the cholesterol gets damaged, then problem starts. So what causes the damage to the cholesterol? It is not the egg yolk which is causing the damage to the cholesterol. Rather than the egg yolk, the damage to the cholesterol is done by your sugar. Damage to the cholesterol is done by your insulin resistance. Damage to the cholesterol is done by whenever you are taking excessive sugar, excessive refined carbohydrate. Damage to the cholesterol is done by when you are smoking. Damage to the cholesterol is done by when you are taking excessive amount of refined oil, fried items, excessive amount of omega-6. Damage to the cholesterol is done by when you are excessively stressed or your sleep is compromised on a regular basis. So all those things actually causes damage to the cholesterol, and damage to the cholesterol, when the cholesterol gets damaged, the bad cholesterol gets damaged, it gets inside the blood vessels, and thereby they causes heart blockages and heart attack. So You have to remember, it is not the absolute amount of cholesterol which is important. More than the absolute amount, it is the quality of the cholesterol which is very important. When the cholesterol gets damaged, it sets the stage for heart disease, heart attack, and stroke. And another important thing you should also remember, that dietary cholesterol in the diet is not equal to the cholesterol in the blood. Like so many people who take eggs on a regular basis, like myself, I also take eggs on a regular basis, but still my cholesterol is not elevated. Why? Because as we have discussed till now, our body has a mechanism where the liver responds by either producing more cholesterol or less cholesterol, depending on how much you are taking in the form of diet. So, but there are some individuals where this balance is altered. In those individuals, we call it hyper-responders. So, what do you mean by hyper-responders? By hyper-responders, we mean that this group of individuals, when they take dietary cholesterol, when they take cholesterol in the form of diet, the liver doesn't decrease the synthesis. So, liver also maintains the synthesis of cholesterol. So, they tend to have higher cholesterol in their blood. So, these are known as hyper responders. So, when this hyper responder group of people, when they take increased dietary cholesterol, their blood cholesterol also raises. But you should remember, this hyper responders are very small in number. They are minority, and majority of us are those individuals where your body synthesizes the cholesterol, the liver synthesizes the cholesterol according to what is our dietary cholesterol. If our dietary cholesterol intake is less, liver will synthesize more. If our dietary cholesterol intake is more, liver will synthesize less, so that our blood cholesterol remains stable. So this hyper responders and how the body responds to dietary cholesterol was actually tested by various scientific experimentation. In various scientific experimentation, it was seen that when the subjects increased their intake of cholesterol from 1 egg to 3 eggs, and the researchers have seen how the body responds to it when the subjects increase their cholesterol intake from 1 egg to 3 eggs. How much cholesterol are there in the blood, how much cholesterol is being synthesized by the liver, how much cholesterol is getting absorbed from the food, and how much cholesterol is getting excreted by the liver. So the researchers have found out that when the dietary cholesterol intake is more, when the subjects had taken more cholesterol in the form of more egg, they increased their intake from 1 egg to 3 eggs. What happened? The liver synthesized less cholesterol, and the liver excreted also more cholesterol in the form of bile, so that body maintained a balance. So that is the normal thing for majority of us, where the liver responds to dietary cholesterol by either increasing or decreasing the cholesterol synthesis and increasing the cholesterol excretion. So there are two types of response from eating egg. The majority response is what we have discussed. The liver responds by either increasing or decreasing cholesterol synthesis to maintain the cholesterol balance. But in few minority of individuals, this balance is altered, where if you increase the dietary cholesterol, the liver also secretes more cholesterol synthesis, so that ultimately your cholesterol is higher. So this is known as hyper responders. So how do you identify those hyper responders? You and me could be hyper responder. So how do you identify those? You identify those by initially checking a blood cholesterol lipid profile, and after that increase the egg intake in your diet, and after 6 to 8 weeks check once again your lipid profile. And if the lipid profile shows the bad cholesterol increases significantly, then you can say that probably the subject was a hyper responder. And this group of individuals are minority, they are not the majority. So if this is minority group of individuals, probably you need to restrict the egg a bit. But for majority of us, we need not restrict. So egg cholesterol doesn't mean, if you are taking more cholesterol in the form of egg, in the form of egg yolk, it doesn't mean that your blood cholesterol will increase. Your blood cholesterol is dependent on your liver function. Your liver will adjust and will maintain your cholesterol level. So till now you have understood that taking egg yolk is safe. Taking egg yolk doesn't mean that although it's a rich source of cholesterol, doesn't mean your cholesterol will increase in the blood. And on top of it, cholesterol is not the root cause of heart disease. It's when the cholesterol gets damaged because of sugar, because of inflammation, because of stress, because of smoking, because of refined oil, because of fried items, then only it sets the stage for heart disease or heart attack. So egg is safe, but egg is also very, very effective. Especially egg is a very good source of protein. So egg protein is one of the best source of protein because it's easily digestible, easily available for the body. And egg proteins are quite inexpensive and readily available. When we age, after 40 or 50, our body loses muscle every decade. And on top of it, our metabolism also slows down. So this is known as sarcopenia. We tend to lose muscle, we tend to gain fat, we tend to develop insulin resistance, we tend to develop more diabetes as we age. So that is age related. And on top of it, most of the time, we decrease our protein intake in the form of egg once we age. So that's a double trouble. When our body required more egg, we are taking more protein, we are taking less protein. So that creates a problem, that creates a protein deficiency. And long-term protein deficiency will lead on to fatigability, excessive tiredness, poor wound healing, immunity is decreased, recurrent infection risk is there, recurrent fall risk and fracture risk increases significantly. So egg becomes a protective in those golden years, in senior years where we require more protein. So egg is a very good source of protein. So when we age, we require more protein, and egg protein forms a very important part of diet. So how many eggs are safe? Most of us can take 1 to 2 eggs per day. Those who are very active can take up to 3 to 4 eggs per day also. But especially for diabetics and those for heart disease, they could take it depending on what is the individual response. If somebody is hyper responder, then they can reduce the intake of taking 1 egg per day. How to take the eggs? Especially you can take the egg either by boiled eggs, you can take, or you can make an omelette with a minimal oil or some amount of ghee, but do not make eggs with excessive frying or using a refined oil. So pairing of eggs is very important. Pair eggs with other source of protein, pair your eggs with vegetables, but do not pair your egg with other refined carbohydrate. Like very commonly we take omelette and bread. So do not pair your egg with a refined carbohydrate source. Pair with a protein source, pair with vegetables. So take home message is, cholesterol is not villain, and egg yolk is not the enemy. Egg intake doesn't cause increased cholesterol. It is the cholesterol, when it gets damaged, they lead on to heart disease and heart attack. And what causes damage to the cholesterol? It is sugar, it is diabetes, it is insulin resistance, it is high refined oil, high intake of refined oil, fried items, excessive omega-6 intake, smoking, stress, and lack of sleep. All those things damages cholesterol, which leads on to blockages and heart attack. It's not the cholesterol in the egg yolk. So who should be mindful about eating eggs? Most of us can take eggs on a regular basis, but those who are having especially diabetes and especially heart diseases, and those who are having hyper responder, as we have discussed, for those after taking few eggs also, 1 or 2 eggs also, their LDL increases significantly. They should be a bit more cautious. They also can take 1 to 2 eggs they can take per day. So all in all, egg forms a important balanced nutrition in our diet. They are helpful, they can prevent various diseases, they are a good source of protein. And only very minority of individuals, especially those who are hyper responders and those who are having diabetes or familial very high cholesterol, LDL cholesterol, they could be bit more cautious. And what about cholesterol intake and heart disease, or egg yolk intake with heart disease? The research has shown that egg yolk intake is not related to heart disease. Various studies have done that. Even Harvard study was also done, which showed that in fact egg yolk intake is protective for heart. If at least it is not harmful for the heart, because egg yolk although increases your LDL cholesterol but also increases your HDL cholesterol, that is the good cholesterol. So ultimately the ratio between the LDL and HDL remains the same, and for heart disease the ratio which is more important than the absolute value. So if your ratio maintains the same, then it doesn't cause any heart disease. So your egg yolk, cholesterol in the egg yolk, although it will increase our LDL a bit for few of the individuals, it won't cause any heart disease because the ratio of HDL and LDL remains the same. So all in all, egg yolk with heart disease has been shown that there is not such correlation. In fact, it could be beneficial, at least it is neutral, it is not harmful at all regarding the heart health. So start your day with a positive note. Take a protein rich breakfast, especially take eggs, because eggs, as we had previously thought that it could lead on to heart disease because a rich source of cholesterol, has been shown in various scientific studies that it is not so, because eggs are very good source of protein, they are very nutritionally sound. Egg intake is not associated with increased cholesterol for majority of us, and egg intake is not associated with heart diseases. So if you like our content, kindly like, share and subscribe to our channel. And next video we'll be talking about whether all eggs are the same or not.